What is cannabis? Cannabis is a naturally occurring drug that comes from the cannabis plant. Cannabis contains a chemical called THC which moves the bloodstream into the brain. THC is a sedative, leading to relaxation and sleeplessness. How is it taken? Cannabis, also known as marijuana, pot, hashish and weed, is most often mixed with tobacco and smoked as a joint. It can also be smoked using a pipe, through a bong, and even mixed into tea or with food such as cakes and cookies. There are three main forms of cannabis: marijuana, hashish and hash oil. Marijuana is the most commonly found cannabis and the least potent. Trends in Australia. Cannabis is the most commonly drug ever tried or used in Australia, with 37% of Australians have tried cannabis at some point in their life. Among school students, there is a downward trend where the rate has gone from 35% in 1998 down to 30.6% in 2008. Since 2008, cannabis is on the rise again amongst the age of 13 to 19 years of age, a rise in 2%. In the past year, female users of cannabis have almost equaled to be the same as male users. In 2008, cannabis-related hospital admissions are greatly higher than those from 2001. Cannabis can cause both physical and mental health risks. A recent study in 2 senior hospitals among cannabis-related incidents, mental health and injury problems were the most common, with high rates of anxiety and suicide risk, followed by depression and schizophrenia. Immediate effects of cannabis. Some immediate effects of cannabis include spontaneous laughter, quiet and reflective moods, confusion, altered thinking and memory, anxiety, mild paranoia, altered vision, bloodshot eyes, relaxation, sleeplessness, reduced coordination, increased heart rate, low blood pressure, and increased appetite. Long-term effects of cannabis. If cannabis is used regularly, it can cause health problems such as increased risk of cancers of the lung, mouth, throat and tongue, increased risk of psychotic symptoms, cannabis dependence, reduced fertility in both men and women, increased risk of possible birth defects, increased risk of lung infections, and increased risk of major depression. The risk of young people using cannabis. The population of young people at the greatest risk using cannabis. People who use cannabis at a young age are likely to experience negative consequences later in life. Young people who are using cannabis are at greater risk of taking stronger drugs, developing mental problems in the future, general problems in life, conflicts at home in relationships, difficulty learning and poor memory, dropping out of school or leaving home early, legal issues and financial difficulties, and violence. Socio-cultural factors that influence risk-taking and cannabis use in young people. There are many influences that encourage cannabis use within young people. This includes such things as emotional stresses, including depression. This can cause poor risk choices and rebellious behaviour. Poor parenting and no concern for their children's welfare can have dramatic effects in life. For example, no discipline on drug use such as cannabis or dropping out of school early, which leads to poor education. Teenage peers that regularly use drugs such as cannabis are a significant influence. Moving out of home at a young age can have an effect on one's discipline and links to poor behaviour choices. Smoking tobacco can be an influence as it can be seen as a gateway to smoking marijuana. Lastly, having a positive experience when first using cannabis can cause people to keep using it.